I'm Inga Aikman. I'm one of the associate program directors. I also work as the rotation director for the inpatient rotation for the pediatric residents. And recently I've been put in charge of our career development rotation as well. I went to med school in Philadelphia, and so as a student with student loans, finding places to live that I really loved and were affordable, were challenging. But here, cost of living is amazing. So you can live very comfortably and have outdoor spaces, a backyard. So cost of living here is great. I feel that the city itself is small enough to get to places quickly, but big enough that you get, that college town feel with a lot of cool mom and pop restaurants, both uptown and in the surrounding areas. So you kind of get to see how eclectic Eastern North Carolina is. And then there's just a lot to do outdoors. If you're a big, beach person, the nearest beach is about an hour and a half away. There are a lot of places to walk and run or ride a bike around town. So there are always little gems to find in Greenville if you go looking for it, and it's nice to kind of get insight about that from the people that we work with every day. I think this program has a big family feel. So faculty really do take residents under their wing in various arenas, whether it's academic and wanting to make sure that you're staying on top of your board study plan, or making sure that you do well in a rotation. As a rotation director, I've had the opportunity to work with many residents who are very strong in one area but might need help in another area, and so that's been great to kind of build relationships and help to see them improve along those areas that they have to work on. But also from a personal standpoint as well, I think the faculty are really invested in wanting to make sure that you are doing well outside of work. And giving you encouragement to keep going, especially when things kind of get challenging. Personally, I remember when I was a chief resident studying for boards, kind of in the throng of everything, one day I walked in to my office and there was a little gift bag on my desk a few weeks before with a gift from a faculty member, just with like socks and gummy bears and like chopstick, just as an encouragement to keep going for that last week before boards. So they're really invested in wanting to make sure that you're doing well, both within your professional life but also your personal life too. Yeah, so I think one of the things that I have really appreciated is the diversity of our program. We are located in a smaller city in Eastern North Carolina, but that doesn't detract from the diversity that's both here at the medical school, the university, and the community at large. So I've had the opportunity to work with residents and faculty from different countries and states, and also our patient population is incredibly diverse, both from a socioeconomic standpoint, ethnically as well. And I think it just provides a unique experience here that we get to work with and collaborate people from different backgrounds, and also get to serve patients that bring their own experiences too. So I definitely feel that you kind of will have the opportunity to see a broad range of cultures here, which has been great and helps to make you a more competent physician having trained here. I came to North Carolina originally just to get closer to family. My brother and sister were doing their undergraduate work at universities in the Triangle area, and I wanted to be closer to them during residency. I ended up really loving the people here. I think everyone that you've talked to has probably talked about how amazing the residents and faculty are here, and just being able to work in a very collegial and collaborative environment was great. So much so that I stayed on for an extra year as a chief resident, which brought its own challenges, but was also a very fulfilling experience. And then I was interested in pediatric hospital medicine and decided to do fellowship and got matched in Ohio at Akron Children's. And after fellowship, came back here again to be closer to family, but also because I consider the faculty here family too. It's always nice when you kind of leave your home institution and people are still keeping in touch with you and recognizing that you have something to bring to the program. And so I was really fortunate that I was given the opportunity to come back and work with the amazing faculty here, and also get to work with the residents a little bit more intimately too. We're just really happy to have you take a look and learn more about our program, and we hope that you strongly consider us. We're looking forward to meeting you, albeit via virtually, but we're excited to get to talk to you and get to learn more about you.